So the observation, first of all, we've only known about this for a little while. We should have known about it a long time ago. But it turns out the sidedness matters for metastatic disease, not for stage 2, 1, 2, or 3, at least the best we can tell. It may be that the right side is just a different disease because it comes from a different part of the embryo. The right colon comes from the midgut, the left colon from the hindgut, and the transverse colon is where they merge in embryogenesis. There may be some mild molecular differences, a tendency for BRAF mutations to be on the right side. But we actually, our working hypothesis right now is more that it's got to do with the biome, the microbiome, which may either impact the biology of the cancer or the impact of the immune system on the cancer, and even the impact of chemotherapy on the cancer. So we're not exactly sure, but we think the biome may be responsible. Some of this is fed by the recent observations, the amazing observations that you can find bacterial DNA in tumor metastases. So let's say you take a biopsy of a patient with liver metastases. When we do next-gen sequencing looking for the genetic mutations, we throw away a lot of DNA, which doesn't make sense. Turns out some of that may be bacterial DNA. And what's that doing there? And if it's there, is it there for a reason? We see it in colon cancer liver metastases. We see it in pancreas cancer liver metastases. Maybe we'd see it everywhere if we looked. And so that's a mystery. I think that's the most exciting thing in terms of the challenge of figuring out just what the biome is and what we can do about it. But that may account for the sidedness.